So what's the percentage of the retinol in Duality, somebody's asking?
Well, it depends on whether it's Duality or Duality MD. So it's pretty close to about a 0.5% in the Duality and a full 1%, close to full 1% in Duality MD. Now, let me qualify that, because just asking what the percentage is isn't
Doesn't mean
going to
anything.
be helpful. I usually ask people, well, why do you want to know what the percentage is? Now, commonly, if I ask somebody, what's the difference between retinol and prescription Retin-A, they go, oh, prescription Retin-A is stronger. Now, that is true, and it's not true. So when you when you put retinol on your skin, what happens is you have an enzyme. Everybody has this enzyme, and it immediately changes into retinoic acid or tretinoin. That's the same exact active ingredient that is in a prescription retinoid. It changes it into that. Now, when you have a conversion that takes place, typically you lose something in the conversion. So sometimes the conversions are 2 to 1 or 3 to 1 or 5 to 1. In this case, it's 10 to 1. What that means is you need 10 times more retinol to equal what you would see in a prescription product. So that, people would say, well,
Right.
that makes sense. So you just do 10 times more. Well, guess what? Retinol is actually far more aggressive and difficult to acclimate to than any prescription retinoid. So that's why you see tiny little percentages in products in drugstores. You can get it in Neutrogena, you can get it in lots of products, but they're not going to do what we're talking about. So what we were able to do, which is really unique and different, is we were able to actually take that 10 times more, which will equal and actually go beyond, because Dr. Kligman, who invented retinoids, prescription Retin-A, actually stated that retinol is more bioavailable. It will actually work better. It's about, though, equaling the percentage. And so we were actually able to do that. So if you had the highest strength of a prescription retinoid, it's 1/10 of 1%. Right. So you'd have to use a full percentage. So the Retinol MD is a full percentage of retinol. And I want to tell you, in our studies, and we did one of the studies was done with a dermatologist in Sacramento, 78% of patients, 78% had no acclimation. Now 22% in the beginning might have a little bit of slight redness or flaking, which is easily managed by simply lessening the frequency temporarily. Now, the most prescribed percentage of a prescription retinoid in the U.S. is like Renova, or the 0.5%. I always call it the 0.5 of 1%, 0.05. That's the most prescribed, whether people are using products like Obagi or anything like that. So when you're getting your duality, your regular duality, that's what you're getting.
Right. Oh, that's.
So think about that. You can get, by non-prescription, you can get from Sue something that's really, really, really potent. And
Powerful.
That's prescribed more than even the highest percentage.
And the way you formulate it is so amazing, because they're not going to get the reaction. We had somebody just pop on a few minutes ago that just asked, she goes, I'm 55 years old, but I have dry skin. Can I still use retinol? Depending on how and what the formulation is.
Made for dry skin.
Okay.
So the reason somebody's skin is dry, there's several reasons. It's typically something called increased corneocyte cohesion. So this layer of skin out here, the stratum corneum, is supposed to lay like shingles on a roof, very cohesive, very even, like fish scales. And in between, there's a lot of hygroscopic substances, a lot of moisturizing substances, mucopolysaccharides and ceramides and phospholipids and hyaluronic acid, known as glycosaminoglycans, that make the skin feel really soft and, I like to say, juicy looking and plump. So as you age, those cells become disorganized. They pile up. There's even a name for it. They become dry, they shrink, and they cornify. It's called increased corneocyte cohesion. And you have less of those substances. So when we resurface and we also stimulate those substances, we stimulate collagen, it changes the nature of the skin completely. Skincare management is where it starts. And then you go to the very specific things you need maybe to add on to more specifically address acne or discoloration or rosacea or any number of different skin concerns.
Right.